Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on Gout or Gouty Arthritis. So, today in this lecture, we are going to discuss about Gout, which is also known as Gouty Arthritis. Now, before we start our discussion on Gout, I would like to show you some photographs of the patient who are suffering from the Gout disease. So, in this photograph, here you can see what exactly happens in Gout. So, the joint of the toe is swollen and inflamed, and as you can see the uric acid crystals are deposited at the joint. Now in this figure also, okay, bone erosion is taking place, then uric crystal in a topus synovium. Now this figure, okay, this is also Gout. So you can see so much uric acid deposited at the joint, and the joints are immovable. Here also inflammation and immovable joint due to uric acid deposition. Okay, over here swollen and inflamed joint, masses of uric acid, toffee, uric acid crystals. Over here Gout. Okay, now this Gout, see over here. So see 4 to 6% of the population suffers from Gout. Okay, now this is the structure of uric acid, and uric acid is the cause of Gout. So here uric acid crystals are deposited at the joint. Now the symptoms include inflammation and redness at the joint, then temperature increase of etching joint. So at the joint temperature increases, and as you can see severe pain, especially at night. So patient suffer from severe pain during night. So here you can see in the finger joint redness is observed, and inflammation and swelling is also observed. So joints are immovable. And here in the feet, as you can see, the big toe joint is suffering from Gout. Then ankle joint is the place where the uric acid is deposited. Then at knee joint uric acid is deposited. Then causes why the Gout occur. So the reason why why the patient suffer from Gout. So sedentary lifestyle means a person is sitting at one place for a longer duration, for example watching a TV or movies or playing a video game entire day. So that we can say sedentary lifestyle. Person is not doing exercise, person is not doing yoga, person is not doing pranayam, person is not going to gym. So this is called sedentary lifestyle. And so much food person eat, so the person become obese. So sedentary lifestyle and obesity is the reason for Gout. Then second cause is the harmful product, especially if person is eating too much meat or if the person is drinking too much beer, so that can lead to formation of gout. Then in gout, kidney do not excrete uric acid. Kidneys are not able to excrete uric acid. Now the treatment for gout include anti-inflammatory drugs and painkillers. So now we are discussing about gout. What exactly the gout is? What are the symptoms? What are the causes? And what are the treatment for the gout? Now, gouty arthritis. See, first of all, uric acid. What is uric acid? Uric acid is a substance that is present in urine. So, presence of uric acid in urine give the name. So the name urine is derived because the uric acid is present in the urine. That's why the urine is named because uric acid is present in the urine. Now, uric acid is actually a waste product, and this uric acid is produced by the metabolism of nucleic acid. So when DNA and RNA in our body metabolize, that time uric acid is produced. Now, a person who is suffering from gout, either producing excessive amount of uric acid, so much uric acid is produced in the body, or another reason that a person is not able to excrete as much as normal person the uric acid. So that's why in the blood uric acid as a result the uric acid is going to build up in the blood. Now, as the amount of uric acid increases, so this excess uric acid reacts with the sodium. So when the uric acid react with sodium, so the salt is formed, and this new salt which is formed is known as sodium urate. Now this salt, sodium urate, is present in the form of crystals. Okay, so this crystals, so the crystals of sodium urate accumulate in the soft tissue of kidneys and also in the cartilage of the ears and especially the joints. Okay, now in gouty arthritis, sodium urate crystals are deposited in soft tissues of joint. Gout most often affect the joint of the feet, especially at the base of the toe that we have seen in the figure. Now, as the sodium urate crystals are deposited, accumulated at the joint, due to this accumulation of sodium urate crystal, this crystal irritate and erode the cartilage of the joint, and due to which it causes the inflammation, swelling and acute pain at the joint, and eventually finally the crystal destroyed the all joint tissue. Now if gouty arthritis or the gout disorder is untreated, if no treatment is provided to the patient, so it will end of the articulating bones fuse. So what happened at the joint, the two bones are going to join together, they are going to fuse together, and the joint becomes immovable. So the person is not able to move the joint, so there is no movement possible at the joint because the articulating bone has joined together. That's why. Then at the joint, as we have already discussed, there is so much inflammation, swelling is there due to the sodium urate crystals are deposited. Now the treatment involved for the gout, so the pain relief drugs are given to the patient. For example, ibuprofen, naproxen, colchicine and cortisone. All these drugs or the painkillers are given to the gouty arthritis patient, and also the dose of allopurinol is given. Now the allopurinol, what this drug is doing, so it is keeping uric acid level low in the blood, so that the crystals do not, so the sodium urate crystals are not going to form. Okay, so these are the drugs which are used in the gout or the gouty arthritis disease. Now once again, gouty arthritis. So see, uric acid, as we have discussed, uric acid, what is uric acid, how it is produced. So uric acid is actually a waste product, and it is produced by the metabolism of nucleic acid, DNA and RNA. Now ordinarily, the ordinary person excrete this uric acid in the urine without any problem. Okay, but sometimes in some people, what happen, in the blood the uric acid level rises excessively. So due to its excessive production or slow excretion, this uric acid may be deposited as needle shaped urate crystals, and these urate crystal, which are needle shaped, they are deposited in the soft tissues of the joint. So as the urate crystals are deposited in the soft tissue of joint, there is inflammatory response, and due to inflammation or the swelling, this leads to agonizing, that means intolerable, painful attack of the gouty arthritis or the gout. So that means when the uric acid crystals are deposited, they are accumulated at the joint. That portion of the joint is inflammatory response you will observe, and there is a swelling, and this condition is very painful, and often the two bones are going to join to each other, and the patient is not able to move at the point of joint. Now, generally, the initial attack typically affect one joint, but after that, many joints are going to suffer from this gout attack. So, the first typical attack start at the is observed at the open at the base of the great toe. Now, gout disorder or the disease, gout disease, far more common in men. So generally, men are affected by, in comparison with the women, because the reason why the men are more affected by gout, the reason is men naturally have higher blood level of uric acid. So high amount of uric acid is present in men's blood. Now, when we compare men with the woman, in the woman, as you know, there is a high level of estrogen, and estrogen increases the rate of excretion of uric acid in the urine. So due to that, as women are excreting more uric acid in the urine, so that's why men are going to suffer gout than the woman. Okay, now because gout seems to run in family. Family means, see, if a grandfather is suffering from gout, so there are chances that his son is going to suffer from gout, and in successive progeny, the children of the family are also going to suffer from the gout. So it is possible that genetic factor is definitely involved in the gout disease. That's why from progeny to progeny, the people are suffering from this disease. Now, if gout is untreated, the gout can be very destructive, and if the gout is not treated, what happen, the articulating bone means the bones which are present at the joint, they are going to join each other, they are going to fuse, and it will immobilize the joint. So the person will not able to move the make a movement at the point of a joint. Now, fortunately, luckily, there are several drugs available in the market. For example, colchicine is there, non-steroidal anti-inflammatory drugs can be used, glucocorticoids and other drugs can be used in the treatment of the gout. That and these drugs terminate or prevent gout attack. Now, similarly, a patient are also advised to drink plenty of water, and a patient is also advised to avoid excessive alcohol consumption. Here the alcohol means the wine, beer, whiskey, rum, brandy. So all this product should be avoided which contain the alcohol, because alcohol consumption promote uric acid overproduction. Okay, then the food high in purine, for example the meat. So in meat, for example liver and kidney. So the gout patient should avoid consuming liver and kidney, and sardines are the fish which contain high amount of purine. So gout patient is also advised to keep away himself from the meat, liver, kidney and sardines. So these are the precautions that the gout patient should take. Now some more information regarding the gout. So gouty arthritis or the gout. Okay. So with this we have completed our discussion on gout or the gouty arthritis. I hope you have enjoyed this lecture, and I also hope that this lecture will be helpful in your exam preparation and also in your studies. My name is Manish Kushti sir. I am from Ahmedabad, India. Bye bye. Namaste.